Assalamu alaikum everyone. Today we will talk about necrosis. What is necrosis and what is type of necrosis? Necrosis. It is a form of cell injury which results in the premature death of cells and living tissue. It caused by a factor external to the cells or tissue such as infection, toxin or trauma. Necrosis is almost always detrimental and can be fatal. Types of necrosis. There are several types of necrosis with a unique set of characteristics. Coagulative, liquefactive, gaseous and fibrinoid. Coagulative necrosis. This is the most common type of necrosis and is usually caused by a sudden lack of blood supply to a particular area called ischemia. The affected area becomes firm and fail. It's often seen in heart attack. Liquefactive necrosis. This is the type of necrosis is often associated with bacteria or fungal infection. The cell die, but the catalyst that cause the death, like pus-forming bacteria, continues to be active and digest the dead cells, turning the affected area into a liquid mass. Gaseous necrosis. This is a type of necrosis characteristic of tuberculosis. The dead cells disintegrated but are not completely digested, leaving a cheese-like gaseous appearance. Fat necrosis. This type of necrosis occurs when fats are broken down, often in the pancreas or breast. The necrotic tissue has chalky appearance due to the combination of digested fats and calcium and process known as saponification. Gangrenous necrosis. This is not a special type of necrosis, but a particular pattern of cell death, typically due to a critical insufficient blood supply. The normal tissue and the gangrenous tissue, characterized by a black color tissue, become its black. Necrosis. Necrosis is a serious condition and often lead to a further health complications. It's important to understand different types to ensure appropriate treatment and management.